Hello, and welcome to episode 14 of the Homeopathy Simplified podcast and video blog. In this episode, I want to talk about a really important subject in regards to homeopathy in general. And I want to start out by saying this statement: learning about remedies leads to limited results. And this is a hard argument to convey in a short video or podcast. But it's a very important idea in homeopathy that we don't just use homeopathy based upon our knowledge of the remedies. In fact, in the new books of homeopathic remedies, there are 3,600 plus remedies, and so no one would have the memory for that number, let alone all of their indications. So my name is Jonathan DeMonte. I'm a homeopath and Bowen therapist, and as you know, I discovered homeopathy through my father, who in the 60s was one of the key teachers in homeopathy's resurgence at that time. And I'm really fortunate to have studied through his students, and I really feel a strong connection to him and his career. After becoming a homeopath, I became a Bowen therapist, and I developed a practice focusing on chronic pain and disease. And now, after 27 plus years, I've come full circle. And I want to share my knowledge, and I've made a purpose of teaching a course that really is the one I wished I'd had in the very beginning of my career. And much of the content on this podcast and video blog is really coming through that course and enables me to convey some of the ideas about learning homeopathy, learning how to do it reliably and simply, and shining a path through the complexity, like a path through a forest of ideas and misconceptions. And as always, I'll show a picture of my dad. It always comes up fuzzy, but anyway, it gets into focus pretty fast. So he's probably looks a lot like me with hair. And he died when I was young, when I was 12. And he had a big following of students at that time. So, in the dictionary, limited success in homeopathy was my title of the podcast today. And limited means something that bounds, restrains, or confines. And what it bounds and constrains and confines, is the possibility of other remedies not known for a particular condition having a better effect on the particular case you're treating. So choosing a remedy based on its description of what it treats, is the most common way homeopathy is used. In fact, I go on I was going on Facebook for a short time to look at, the homeopathy groups, and very often, people are posting information on request for this disease and that disease and what remedy and what protocol. And one of the most common replies that I admire is that people should really consult a professional homeopath to discuss the variabilities of the prescription, that just choosing a remedy based upon its common use isn't the most reliable form of homeopathy. And I'm going to try and convey this through a sphere of pathology, common physical injuries, just bangs and scrapes and that sort of thing. And to do that, we'll look at an image of something called traumatic man. This is very, very well known to homeopathic students, as they use it in a lot of lectures to introduce some remedies. And, it just depicts some of the injuries that might be needing a remedy or benefiting from a remedy. So everything from a black eye, and you see a remedy name called ladum, heat stroke, belladonna, glonoian, antimonium crudum. These are remedies really strongly indicated for those conditions. And because they're common conditions, common remedy might treat many, many people's injury. So here we have arnica, and it says to use first in all injuries for shock, pain, bleeding, etc. So why does it make such a strong claim as to use it in all injuries? And that's because our body's response to injury is pretty much automatic. It's the same for everyone. There's no nuance there. If you fall over and bang your knee, it's going to be in pain. It's going to be swollen. It might even have a bruise, etc., etc. We might even feel a little shock from the fall. That's why arnica works so well. Here's another common remedy for injuries, and that's ruta graveolens for wrist injuries. Really wonderful, but it's not the only wrist remedy. And what do you do if you only use a resource like this that says ruta is the remedy for wrist and it doesn't work? How do you go about resourcing a better remedy, a more precise remedy? You might think, well, homeopathy didn't work. Well, it wasn't that homeopathy didn't work. It was that the remedy didn't work. Now, Hypericum perfoliatum is very interesting because it's for nerve pain, a nerve injury. Let's say you bang your fingers in the car door and you have that excruciating, numbing nerve pain. Well, Hypericum perfoliatum will address that in minutes. In fact, in seconds, you'll see. It's an incredible remedy for that. In fact, sometimes where you expect you'll have broken nails and blood under the nail from that injury, it doesn't show up. It's remarkable. Hypericum perfoliatum is actually St. John's wort, which is used herbally as a nervine to calm the nerves. Even people use it to sleep, etc. But however, in homeopathy, it's used very differently. Here we have more in the lower part of the body, wounds. We have calendula, hypericum again, bruises, ladum, rust toxin, ruta for strains, muscle strains, arnica, tendon injury, ruta, old sprains, rust tox, and so on and so on and so on. It's not the point to learn these. It's the point to depict that these are common injuries and therefore common remedies will treat them. Here's a graphic to show that. This is a bell curve of the number of people who would take a certain remedy and based upon their characteristic symptoms. So arnica for injury is very, very common. A lot of people have that similar group of symptoms, whereas ruta and ledum and bellus perennis and rust tox is a little more narrow field of symptomology. So therefore, it's not that you can try one after the other. The goal in homeopathy is to choose the best remedy that matches the state of reaction to an injury or fall. So when you talk about a bigger range of pathology, you think about all the bodily pains of musculoskeletal problems, from arthritis to gout to sprains and strains and fractures and dislocations, fibromyalgia, repetitive strain injury, a meniscus tear, a nerve injury, etc., etc., etc. You have umpteen possibilities of pain and injury and disease that are musculoskeletal, and you can't narrow it down saying hypericum for every nerve injury, natrum carbonicum for every concussion, or mag-phos for every herniation, ledum for every plantar fasciitis, and so on. You can't do it. Fracture, you can't say it's always symphytum. You can't, because very commonly there's many more factors to this expression of the person's symptoms that require more precise prescribing with a remedy. And then, we've also got all the nerve injuries. When we talk about hypericum, maybe hypericum would address somebody's nerve pain temporarily. But when you're thinking about sciatica or neuropathy or paresthesia, you can't assume that one nerve remedy named hypericum can address those symptoms. It doesn't work that well. So that's the point, is to be more reliable. And here we want to just check in. What are we prescribing on as homeopaths or users of homeopathy? We're prescribing on the symptoms, not the disease. Yes, the disease is important. We have the pathology, we have the patient, your feeling of the disease, you have the assessment, the objective assessments of scans and blood work, of physical, any specialist diagnoses. But what's important for homeopath is what's changed since the injury or trauma. We call it a befallment. And what are useful symptoms to a homeopath? What are those that we use instead of just the disease name? Sure, the disease has to be covered by the remedy we choose, but so do all the characteristics of the symptoms of that disease. So I'm going to jump into some little bit more advanced homeopathy here and talk about what are reliable symptoms. And we break them up into 4 spheres. We want to know about a symptom, the sensation of it, what it feels like. We want to know the location, what and where and how far it reaches, etc. We want to know what are called concomitants. So those are symptoms that arise at the same time, perhaps in another area of the body, another system. So it could be nausea with vertigo. Those are 2 distinct symptoms of the same syndrome. And then, very importantly, in homeopathy, we call them modalities. Modalities are the things that make a symptom better or worse, like lying down, like having a glass of cold water, etc. So I've just mentioned what these are: sensation, causation, concomitants. We have an acronym for that. We call it LOCOMOCO. And we use that to really make sure we've got all the characteristics of a disease. So the disease name alone is just a disease name. It's only one small piece of information, and prescribing on that alone is very, very unreliable. So what are these LOCOMOCO symptoms? So here we have what's called sensation and causation. This we can break up into very basic sensations in the body: pain, stitching, painless, tearing, better touch, worse touch, burning, numbness, boring, all those descriptives of the type of pain that it is. And then we go into what are the modalities of that symptom. So the pain might be only at certain times of the day. Maybe it's very normal to have it worse during the night, but what if it's always at noon? And what if it's always after getting up out of bed that the pain comes on? So the time becomes important. The activity that brings it on, the motion, the weather can play a factor. The emotion underneath the pain. So you could be extremely weepy or very irritable with pain. Just using pain as an example. The temperature of the weather, the climate, and your own sense of body temperature. I mean, how many of us have known a teenager walking around in 35-degree temperature with her overcoat on? It's not uncommon. You see it. The position that makes you better or worse, or the joint or the foot, or maybe lying down is worse for the indigestion, etc. If there's perspiration, if menstruation has a factor in it. So these are essentially things that make it better or worse. And we use those little parentheses in homeopathy pointing to the left or to the right. For worse, for to the left, and better to the right. Actually, I'll type that out in here. Let me just do that now. Because, I want to be sure. This is worse and this is better. So that is how we denote it. So we might write worse, lying, or better, standing. These are how we define the modalities. A concomitant is a symptom occurring with or coexisting with a complaint, whether it's in the same general area or in another area of the body or even in another system. So maybe to give some examples, I could think of, blurred vision with diarrhea could be a symptom. Um, Having a fever with no thirst, that's a symptom. So give it a little example that might work or not, just to describe in these physical injuries. So a man named age 71 came with a friend after 2 days after he'd had a fall, rolling over on his ankle and landing on his left elbow. He had been to the hospital and was diagnosed with a fracture at the tibia near the ankle with a moderate ligament injury and swelling of the foot. That was not really giving him any trouble, and that would be easily treated and easily healed. The problem symptom was that he'd fractured the radial head with a very uncertain prognosis, meaning we didn't know what would be the treatment, the best treatment choice, or how to manage it. It was in a cast, and he did have some pain. So in this instance, we've got some physical symptoms that are medical symptoms. There's a fracture, there's swelling, there was numbness in his arm and hand that had been fractured. But in homeopathy, we've got more important symptoms to almost break it apart and analyze the symptoms more precisely. So we've got the locations, the ankle, the elbow. We've got a factor that affects it. Worse for movement. He couldn't move his hand without causing pain. He had numbness, paresthesia. He was better putting cold pack on the arm. And it was worse for the pressure of touch and for the pressure of a cast. He had a lot of fear about what was going to happen regarding the treatment of the elbow. Would he have to have surgery, etc.? And he developed low blood pressure since. So breaking it apart into the locomoco spheres, we've got ankle and elbow, our location. Modality is the worst movement. Worst movement is a modality. Paresthesia is a sensation. Better for cold pack is modality. Worse for pressure is a modality. He had the concomitant, the accompanying symptom of fear, and also the accompanying symptom of hypotension. So here we have a very clear picture of his state. And why that's so useful is that the remedies are broken up into those types of symptoms. And having reliable number of what we call modalities, concomitants, etc., enables us to more easily and reliably choose a medicine. So the remedy we choose has to be worse for movement, has to have that written in its description. It has to have fear. It has to have low blood pressure. It has to be worse for touch and better for cold, etc. So how do we know those things about a remedy? Is that those remedies were researched methodically hundreds of years ago, and the data has been well recorded since then. And that data is actually super reliable. When the doctors developing the homeopathic pharmacy wanted to research a medicine to show its true medicinal value, they would take it in small doses and develop the symptoms of that medicine. Now, some people in the study would get a certain dose of the medicine. Some people wouldn't get a dose at all. That was double-blind research in the 1700s. It's remarkable. So that data is still completely reliable today. And in fact, it may be more reliable than if we did the studies in this time, because quite honestly, we are a different species. We have umpteen chemicals in our body. We have an environment that isn't necessarily healthy. The food itself is perhaps less than nutritious. So it may be argued that those researchers were a clearer, cleaner specimen to do the research study on. When we get that information, we put it into a chart and we can analyze the symptoms on the left, and we can come up with a graphical understanding of which remedies would be the most useful. And of all the remedies here, I gave this particular remedy called Ladum. And in one of the Materia Medicas I looked at, we had a very nice description that it affects all the joints, especially small joints, small ankles, tendons, heels, and skin. It's where rheumatism begins, and the affected part becomes purple, puffy, and then develops emaciation. So very much a fibrous tissue remedy. So very appropriate. So that enabled me to not offer arnica as the first remedy choice, but to be more precise about the prescription. So listen, I hope that was helpful for you. And, there's always more to understand. This is a simplified version of understanding homeopathy. And again, keep on studying, keep on learning about homeopathy. It's a miraculous form of medicine. It isn't a drug that you take from the pharmacy. It's a stimulus to your own body's ability to heal. So enjoy your rest of your day or evening, and hope we talk soon. Thank you so much.